Aggressive periodontitis, also known as aggressive periodontal disease, is a type of gum disease characterized by rapid and severe destruction of the periodontal tissues that support the teeth, including the gums, periodontal ligament, and bone. This condition is distinct from chronic periodontitis, which progresses more slowly. Aggressive periodontitis can result in tooth loss if not properly managed. We're going to go into this condition in a bit more detail in today's video. If you could just do me a favor before we start and just like the video, it really does help the channel to grow and it really would do me a big favor. So let's talk about the cause of aggressive periodontitis. Well, firstly, it's not fully understood, but it's believed to be the result from a combination of genetic factors and microbial infection. Specific bacteria such as Porphyromonas gingivalis and Aggregatibacter actinomycetem comitans are commonly associated with aggressive periodontitis. Now, these bacteria initiate an inflammatory response that leads to the destruction of periodontal tissues. So we can classify aggressive periodontitis in two different ways. So we can have a localized aggressive periodontitis, and this type primarily affects specific teeth or tooth groups, often with minimal plaque accumulation, and it typically begins in adolescence or early adulthood. We also can have generalized aggressive periodontitis, and this type affects multiple teeth throughout the mouth, and it may be associated with higher levels of plaque and calculus, and it also usually starts at a young age. Now, there are various risk factors for the development of aggressive periodontitis. There can be a genetic predisposition, so if you have a family history of aggressive periodontitis, that would increase the risk of you getting it. An immune response, so some individuals have an exaggerated immune response to bacterial infection, leading to more severe tissue destruction. Poor oral hygiene is another contributing factor. If there's inadequate plaque removal, this can worsen the disease progression. And smoking is also a risk factor for periodontal disease, and that also includes aggressive periodontitis. Now, to diagnose aggressive periodontitis, there would need to be a comprehensive evaluation of the clinical findings, so what it looks like in the mouth, x-rays if they're available, and various microbiological factors. So the common diagnostic criteria include presence in the mouth of severe periodontal tissue destruction and attachment loss relative to the individual's age. So that would also include gum recession and mobility of some teeth potentially. There would be radiographic evidence of bone loss around the affected teeth, identification of specific pathogenic bacteria through microbiological testing, so that's if a sample is taken, and clinical signs such as bleeding gums, swollen gums, and loose teeth, as we just said. So treatment of aggressive periodontitis typically involves a combination of non-surgical and surgical approaches. So in terms of the non-surgical approach, that would include scaling and root planing, which involves removing plaque, calculus, and bacterial toxins from the tooth surface and root surfaces to promote healing. Antibiotic therapy, this could be systemic or local antibiotics, which may be prescribed to target the pathogenic bacteria associated with aggressive periodontitis. Surgical intervention could be possible in cases where non-surgical therapy is insufficient. So surgical procedures like pocket reduction surgery, bone grafts, and guided tissue regeneration may be performed to restore periodontal health and prevent further bone loss. And there would also obviously need to be ongoing maintenance, so regular follow-up visits with a periodontist and proper oral hygiene practices. These are crucial to prevent the disease reoccurrence. So to summarize, aggressive periodontitis, it's a severe form of periodontal disease. There's rapid destruction of the periodontal tissues. We've discussed the causes, which is a combination of genetic factors and bacterial infection. Diagnosis involves clinical, radiographic, and microbiological assessments, and treatment includes non-surgical and surgical approaches, along with ongoing maintenance to preserve oral health. Also stopping smoking if you are a smoker. Early detection and intervention is the most important thing with aggressive periodontitis because the disease is quite rapidly progressing. So the sooner you treat it, hopefully you'll be less likely to lose teeth and you'll be able to maintain a healthy periodontium. So we've made it to the end of the video. If you've made it all the way to the end, leave a 100 emoji. If you have any questions about aggressive periodontitis, leave them in the comment section below. Make sure you like, comment and subscribe, and thank you very much for watching.